My name is James Love. I'm in a group with Andrea Paulo, Andrea Cooler, and Houghton Hazari, and this is our group project on chest pain STEMI presented to the emergency department. So our scenario is Bob is a 45-year-old Caucasian male with a history of hypertension. He presents to the emergency department with complaint of difficulty breathing, chest pain that radiates to his left arm, and nausea with vomiting. He also states that he has some chest tightening as well. And in the emergency department, his blood pressure was noted to be 200/100. The nurse does an EKG and notes ST elevation in the EKG and takes it to the doctor. And the doctor notes that the patient needs to be brought back immediately. So the patient is brought back, and a team of doctors, nurses, and associated care providers begins to work on the patient. He has a history of hypertension. He's a 45-year-old male, born in Jacksonville, Florida. He's an auto mechanic. His diet consists of eating bacon, egg, and cheese biscuits for breakfast, skips lunch, and eats salty meals. Weighs about 250 pounds. He's 5'10". He smokes a pack a day for 25 years. He quit drinking 2 years ago. Lives in a trailer with his wife, who also smokes. He has a poor sedentary lifestyle other than work. He takes the Centerpril 40 milligrams for his hypertension, and he has no known allergies. So with ST elevation, he presents with STEMI. So that is, the patho for that is a heart attack that occurs when the flow of blood to the heart is blocked, most often by buildup of fat, cholesterol, and other substances, which form a plaque in the arteries that feed the heart. The inner blow can damage or destroy part of the heart muscles. And that's from the Mayo Clinic. This is a normal EKG, and this is the ST elevation that is the STEMI that the doctor is worried about. The labs were drawn. The doctor ordered labs, and they ordered CBC, a BMP, and the cardiac enzymes, which are the CK, CKB, and troponin. EKG was already done. The doctors also ordered 2 large bore IVs, a nitro drip, heparin bolus and drip, and initiate oxygen therapy. So these are the orders. The vital signs that he had were heart rate of 105, respiration is 20, setting at 94%, room air before the oxygen therapy, sinus tach with ST elevation, GCS of 15, blood pressure of 200/100. On the assessment, he's clammy, nausea, and vomiting, short of breath. The labs came back and creatinine's 1.0, BUN 17, glucose 150, potassium 4.5, sodium of 140. Now the CK is 250, so that's elevated. Troponin's 4.0, that's elevated. And the CKB of 7, that is elevated. Those are the cardiac enzymes. They are for the show damage to the heart. His hemoglobin's 15, white blood cells 5,000. So the nursing interventions that are evidence-based for this is place the patient in a semi-Fowler or high Fowler position with legs down in position of comfort. Administer oxygen as needed per physician order. Monitor pulse ox regularly. Observe for report chest pain or discomfort, noting location, radiation, severity, quality, and duration. Note the results of the EKG. Recognize that hypertension from low cardiac output can lead to altered mental status and decreased cognition. So the questions are, what signs and symptoms does the patient present with that would be concerning for the triage nurse? And another question is, what are some risk factors does the patient present with that may have caused his myocardial infarction or the STEMI? So here are the answers. Number one, trained nurse should be with pressure or tightness in the chest that raises the left arm, shortness of breath, nausea and vomiting. And his risk factors are age, high blood pressure, smoking, sedentary lifestyle, and obesity.